For many, dental health is an important missing piece in their health care. Learn how the Florida Department of Health in Polk County is addressing dental health, and all the details are coming up on Polk Place. Welcome to Polk Place. I'm your host, Lauren Lingell. Joining me in studio, we have Tanja Johnson. She is the Dental Clinic Manager for the Florida Department of Health. We also have Denise Marini, who works with the dental program at the Florida Department of Health. Ladies, thank you so much for being here.
Thank you.
So great to have you. And you also have this little friend over here. Who have you got with you?
This is Mr. Stinky Monster Mouth. He's the bad bacteria that we have in our mouth, and we teach the children that they need to brush Mr. Stinky Mouth out of their mouth every day to keep the cavities away.
I love him because he even has his own little ID badge, and so he's like on the team. He knows he's bad, and he wants other people to just get rid of all his friends, huh?
Yes, ma'am.
Well, we're here to talk about the dental program, the Florida Department of Health in Polk, and hello, you have a dental program. A lot of people don't know that. So tell me a little bit about, I guess, about the program itself and kind of how it works.
Okay, so we have 4 dental clinics within the county, one being located here in Bartow, and then we have one in Lakeland and one in our Haines City area and our Arbondale area. And those clinics see patients with Medicaid and the uninsured.
Okay, so what types of procedures are they able to do? Is it just like a normal standard dentist office?
Yes, the types of procedures that we do in our dental clinics are your normal fillings, extractions, cleanings, scaling and root planning. So those are the basic services that we render.
For children and adults?
For children and adults.
Okay, and children are considered what age?
We start seeing them around 3.
Okay. So let's say, when is the time to get to the dentist? Obviously you're saying, you know, kids are showing up and families are bringing in their little ones around 3, but really when is the best time to see a dentist?
You know, the age 3, 4, as long as they're able to sit in the chair and they're not afraid. We want them to come in as early as possible, as soon as they start getting those teeth in, around the age of 3, 4, that we can sit them in the chair and we can do an exam on them. Okay,
perfect. And so for adults, though, who maybe have been not seeing a dentist very often, the best time, obviously, to come in would be before there's a problem.
Correct.
For your routine stuff that you need, like what, cleanings?
Cleanings, fillings. Most of the time we would want them to get in as soon as possible, especially before there is a problem, so that we can get them checked out and make sure, get their x-rays done so we can see what's going on with the mouth.
Now, some people might say, what's a big deal about going to the dentist? You know, why is that so important? What would you say to those folks?
Well, it's important because your oral health care is very vital to diseases. So if you have bad oral health care, you could have heart disease, diabetes. It just causes a number of things that can go wrong with your health.
I think it's the thing that people forget the most, that's tied to everything else. You can't just like remove this one part of your body and ignore it and expect to be in perfect health. So it's very important that the work that you're doing to be able to provide those services.
Correct.
So you mentioned a program that you have for children who are just getting in their molars. Tell me a little bit about that.
That's a school-based Sealant program. It is a program that we target the Title I schools here in Polk County. It is 2nd grade, which the reason why we target 2nd grade is because the molars in the back are pretty much coming in at that age. They're usually around 7, 8 years old, some 9-year-olds, But we want to seal those back teeth before they get cavities, so it prevents in the future of them having to miss school and develop healthy habits. Because we also teach oral health while they're there, and that's where Mr. Stinky Mouth comes in. Our mascot, we defeat Monster Mouth with the program.
That seems like a lot of fun, actually. So how do you access these second graders?
What we do is we contact all the Title I schools. We get with their school health nurse and we schedule, and then we actually send out a packet to all second grade parents. Excuse me. We send a packet out to all second grade parents, and they return the consent forms, and once they have a consent form signed, then we can see the children in the school. We have portable equipment. It's just like a miniature dental office, and the kids are all excited when we come in.
What is involved with the sealant? Is it just like a film you like put on there? Or
it's a thin coating that goes over the back molars.
Okay.
And we have the grooves in the back molars, and what it does is it makes it, I tell the children, it makes their teeth like a slide. So when they eat, they don't get food stuck in their teeth. It just slides right off their back of their teeth.
So I'm not a dentist. So the back molars, are those molars that are eventually going to come out, or are those molars that we keep forever?
Those are their permanent ones.
Okay, so for everybody that's watching, in case you didn't pick up on that, those are the ones, that's why we do it that's why they do it then, because those molars are the ones that are staying and for the rest of their lives.
For the rest of their lives.
Take care of those. I wish my mom had done that. I wish there was something like that in place for me, because if I open my mouth right now, I got a whole lot of silver, a whole lot of cavities that got filled. So I'm not going to do that. So are you finding that you're having a lot of success with that as these children get older, that it's doing the job that you thought it would?
Yes, it does. It keeps them from missing school. It also helps with their academics. So therefore, you know, the earlier you get in there and seal those teeth, the better outcome that they have in the future.
And you said it helps with their academics because they're not missing school. They're not absent from like tooth pain or something like that.
Correct.
So for the Sealant program, is there a cost associated with that to have those students taken care of?
All Title I second graders are entitled to it free of charge, whether they have Medicaid, whether they don't have insurance, or even if they have commercial insurance. Every child is eligible for the dental sealants.
That's a wonderful benefit, and like fantastic in terms of prevention. So that's very interesting. Yeah. So what other things do we need to highlight and talk about? What do you want people to know about the dental program?
That they can come to the dental clinic and get services, whether they have Medicaid or they're uninsured, because we do have several programs within the county, such as the Indigent Healthcare Program, where if you don't have any insurance, you just have to meet the eligibility requirements and you can get care at our clinics.
So as far as cost for service, is it a sliding fee scale if you don't have any of those insurances or Medicaid or Medicare? There
is, but if you can qualify for the Indigent Healthcare Program, then there is no cost to you.
Okay.
There also is a program called the Polk County Healthcare Plan, which it costs them $10 a visit.
Any of those 4 clinics, what do? We just pick up the phone, make an appointment? Yeah,
you would call, you want me to give out the number?
Absolutely.
You would call 863-519-7910, and that's our call center, and they make all of our appointments for our clinics.
Okay. Are there any particular things that need to come with the patient to the clinic? They
would need to bring their proof of income and their proof of residence. If they have Medicaid, then they just bring their insurance card. Sure. But if they're uninsured, they would need to bring proof of income. They would need to bring their eligibility for residence, such as an electric bill with their name on it, because you have to be a resident of Polk County in order to get the indigent health care.
Absolutely. what other types of, do you offer educational services? I mean, obviously oral hygiene is very important. So is there an educational component?
Yes, when they come in for their hygiene appointment, our hygienists, they offer oral care education for the patient.
Oh, perfect. Okay. So going in for your visit and you're learning some things that you might not know or might not be very good at if you're me, and you take that with you, and so that's going to keep you right on the straight and narrow in between your checkups.
Pretty much when they come in for their hygiene, the oral education that they're receiving is how to floss, how to properly brush, and why the importance of doing that every day for your oral health. So that's what they're learning when they come into their hygiene appointment.
Well, fantastic. I think it's a wonderful program. I certainly hope that more people utilize it, because as we talked about, it's very critical to your overall health. So great work you're doing.
Thank you.
Thank you.
Thank you for being here.
Thank you for having us.
Thank you for having us.
The Florida Department of Health in Polk County wants you to check out the Public Health Dental Program and take care of those pearly whites and improve your overall health. Money invested in preventive care yields money saved on treatment. For more information on the program, you can give them a call at 863-519-7910 to make an appointment, or you can look them up on the web at www.polk.flhealth.gov.